Welcome to KJTV for your greatest news and programs. I'm glad you're here to listen to wonderful program coming to you. And please don't forget to subscribe or give us thumbs up. Thank you for watching. Welcome to KJTV, and in our midst, we have our guest, Ezekiel Abuzu. Welcome, Ezekiel.
Thank you.
Yeah, Ezekiel is an insurance broker. Can I say you are an insurance broadcast? He works as a corporate real estate asset specialist at Canadian Pacific Railway, but he's also passionate about inclusive finance in community, life, and health insurance. He got this variable life and health insurance license since 2018 and has been a healthcare and life insurance broker since then. Currently, Ezekiel is a broker navigator for MNsure, where he helps community members, immigrants younger than 65, to sign up for healthcare insurance free of charge. And he has helped more than 100 people to enroll for the last 1 year. And he can also help those who are seniors who turn 65 years or plus to enroll in Medicare full benefit. Welcome to Oh, sorry for that. Now, Ezekiel has to talk about the insurance. Maybe I'll give you time to explain more what you do in insurance and how we can be able to benefit. Welcome.
Thank you. Well, as an agent, my role is to help people understand the benefit, the healthcare benefit, and also to get them enrolled in a benefit that is suitable to their need. You know that when you are born, we all take care of our life, which is, to eat properly, to have a sport, and we tend to forgetting about ourselves, and we always take care of our family, we take care of our relatives, and the basic that we need to secure for ourselves is our health, and making sure that at least everything that we eat is healthy. And one thing that people undermine is the health insurance. It's a very important that cover yourself. And so when you need to go to a hospital, you know that you are secure and you not be stressed. So I have seen a lot of need in our community since I came to US, and after finishing my school, I said, why don't I be a beneficiary to school by learning about this key aspect and then help the community in that specific desire? Because I encounter a lot of people who say that you're at the community center, this person doesn't help me, or they don't really understand what I'm trying to explain to them. And I felt like there's a loophole there that we need somebody who is an immigrant who can sit by our community people and listen to their story and translate it as they want it, and that will be suitable to their need so that they can qualify for the healthcare that can make them be affordable. So that's why last 3 years, in 2018, I went on a study to have license in a variable health and annuity license in Minnesota, University of Minnesota here, the state of Minnesota. So once I get that license, I am endowed with a power to educate people about life insurance, about variable annuity, and also about the life insurance, and also get people sign up for the financial product. So that's why I'm, these couple years, I'm more focused on the health side because we are in a pandemic. And also, I want people to make a wise decision so that they make sure that they are covered when they get insurance. So, I will go more in detail of that. And that's why we are here today, and I'm willing to explain and go in detail about what is a healthcare and what is a Medicare, and how people can benefit to get their full benefit of that.
Okay, thank you so much. Now that you deal with insurance, that is very tricky. And we want to know how this works, more especially so many people lost their jobs because of the pandemic. And maybe some of them could not afford to make payments. How can you help on that?
Yes. So before we tackle that question, we need to make a clear understanding about two things. There is a Medicare for Medicaid for senior people
Mm-hmm.
who are 65 years and older.
Mm-hmm.
They are qualified for Medicare if they meet a certain criteria through Social Security Administration. Those are the senior people that our federal government already gave that benefit to, that they can claim when they meet a certain criteria that I will tell you later. And also there is a insurance for younger people who are 0 to 65. And those people are expected either to be a kid, to be in a government program, or under the insurance for their parents, or they are valid from 18 to 65, will have a valid hand to be able to be working. If they are working, then the question is, do they get a group insurance through their employer? So if they have insurance through the employer, it's called group insurance or covered by the employer. In that particular case, the government also offer assistance, but that would be a less assistance because your employer is also pitching in through that insurance. So we're taking the pool of people who are working and now they lost their insurance. So if the group of people who are working and they lost the insurance, then the government have insurance program that they can apply to. The example is this healthcare, this pandemic period right now that people are laid off because some businesses close their doors because there isn't a lot of people coming for the services. Those people have a chance to be enrolled in a government program.
Okay.
And that will be counted as a special enrollment period. So the option that they have to choose to give to the government before they can enroll is to say that this is a special enrollment period and they are being enrolled because of COVID-19 and they lost their job.
Okay.
Anyway, based on MNsure regulation or OSHA regulation, if you lost your job due to COVID-19 or anything else, you have an option to enroll within 60 days.
Okay, so you can join the one for the state.
Yeah, the one for the state called MNsure in Minnesota. In some other states, it might call a different in the state insurance, but you have a 60-day to enroll in that one for coverage if you lost for your employer, insurance for your employer.
Okay. Now maybe can you explain what is MNsure? Because there are other people who don't understand about this healthcare MNsure.
Yeah, well, MNsure is just a government department that is handling all the application. It's kind of a corporate for a broker or where people can shop for the insurance. Okay. And then by signing to a MNsure website, you are giving your information to the government so that they can evaluate your financial status to see if you are qualified for assistance or not. So that's what it is, the MNsure. So when you sign up for MNsure insurance, they will evaluate your income and evaluate the household, and based on that and your status, if you are citizen, a green card holder, or you are a refugee, based on that they can determine if you are qualified for Minnesota assistance or Minnesota care. Or sometimes you can be qualified for private insurance. So MNsure is just a channel to channel everybody to make sure that everybody has a fair distribution of healthcare coverage, and then they will transfer your information plus their assistant to the private health insurance companies. Like example, UCare. They will transfer your information to UCare for coverage, or they will transfer your information to Health Partner for coverage, or they will transfer your information to United Healthcare for coverage. After they evaluate if you are qualified for health or not qualified for health, they transfer your data to those people where you can have a direct coverage from that private insurance.
Okay, so basically, MNsure is not an health insurance. It's just
no, it's not a health insurance producer. It's just an agency, government agency government instituted so that can manage people's data according to make sure that people are properly served about their health care. So, but let me explain this part also. Each state or county have a program called Managed Healthcare. So Managed Healthcare is a program that the state, let's say example of a Hennepin County, can have. They put the money together and then they give put the money somewhere and ask some providers, meaning some hospital, to say, if anybody is in this health program and have this card come to you, you can provide them health coverage. So they have that program, and that program also is administered by Department of Health. But before the Department of Health get your information and also to transfer that for the provider to take care of you, you have to go through MNsure. So MNsure, you apply, MNsure evaluate, kind of oversee everything to make sure you are qualified for the program, and then give your information to Department of Health, and Department of Health make sure that the county give you a card or the information, everything you needed, so that you can go to the provider, provide that card, and you get the service. So there is those small things that they have as a public service to help community members and people get a health care.
Now, the question I have to ask, what benefit does one get going through MNsure if he can go direct to the provider like YouCare straight?
Yes. So there's a benefit. I'm not going to call it a benefit. It's a need basis. So you must suppose if you are 25 years old, you get a job as a supervisor in one of a coffee shop, and they provide you insurance, and your insurance cover yourself and your kid and your wife. You don't need to go to MNsure. You already have insurance for your employer, and that insurance, if the deductible that you have on it is affordable for you, you don't have to. But sometimes there is a case where you can be, young, 25, you have a kid and your wife, but the payment that you are getting from your job is very little.
Okay.
So you don't have enough money to be able to save in case you have a healthcare need. In case your wife have a kid or your kid is sick, you go to hospital. So in that particular case, the benefit you're getting for going to MNsure is that MNsure will make sure that based on your income, your household number, you are qualified to get the same service like somebody else who does not go through MNsure. You get the same payment. So you get that benefit, that service, because MNsure complete or put on top of what you needed, what you have given or you already needed, they complete it for you, so you can get the full service out of, without giving any money out of your pocket. It depends on which one you qualify for. So MNsure have 3 products, I would say. We have Minnesota Care. Minnesota Care is the program that I said that administered by each county or each state, that you don't pay anything. So basically that is for people who are not actually working, but they are less than 65. Okay. So you are not working due to certain condition, you can work, but you need to have a good health so that you don't, transfer anything to anybody else. So those people, you apply for MNsure, and anytime they give you a card, you can go to insurance. But then there's some people who have a good health. They are working, or they have a less income that they cannot afford it. They are qualified for Minnesota Care. So Minnesota Care is just a program they instituted so that they can help people who are already working, but they cannot afford health care
from their place of work.
Not for you. And then the third one is a qualified health insurance. that is the private insurance.
Okay.
Private insurance that you and I can have on the market. Like we can just say, hey, I don't need a MNsure. I have money. I'm a business owner. I have my own hair salon. I'm making a lot of money, making 180K. I can be in that program. You can just go to the private health insurance and get that. That's the time you will need a broker like me to help you, explain to you which one is better, which one is good for you, for your family, and then you can just purchase directly from there. But if you get to qualify health insurance, but you find out that based on your job, you can lose a job anytime, or you might lose a business anytime, and if your business go down, you might lose your insurance afterward because you may not have enough money to pay. The benefit of not doing it directly yourself is and going through MNsure is that once you go through MNsure, before you get that private insurance, MNsure guarantee to the UCare health partner that they will work with you to pay them. So even if you lose your insurance, you lose your job, you can go to UCare MNsure and say, hey, you know what? I was working before. Now I lose my job. I just need to be qualified for one of the another program. And the MNsure will give you that program and you will still go to hospital. You see, but if you went directly and buy it directly yourself, now you lose it. You have to pay that off your own pocket and come back to MNsure and apply it if you are qualified.
Oh, well, that's a good explanation, actually. I didn't know.
Yeah,
I didn't know that. Now, the big question is that we have so many people who do not really care of having taking health insurance. They don't care because when Obamacare started, there was a mandatory clause, which required that everybody had to have insurance, and there was a penalty if you don't have insurance. Now that they removed it, I think it was removed by the House. That is not mandatory. But what advice would you give these people who go without insurance, health insurance?
Well, here's the thing. We need to understand why some people think that they don't need a health insurance, and that will bring them on board. Well, imagine you are working here, you're giving the money to people, you're sharing the money, you're going to, drink a bottle of wine, a vodka. Healthcare insurance is kind of a treat for yourself in case you fell sick. That's the time you will know the benefit of having that insurance. So you can buy a bottle of vodka for $34 or $45 and pop it, pam, right? But you can also pay $25 and get coverage for a full operation and then $0 in the future. So that's the point people don't understand is that they don't know. They say, well, I'm healthy. I'm a very young, I don't need any health insurance today. But they forget that the health insurance is like, how can I say? It's like the treat that you are doing for yourself. Instead of that is the only thing that you are protecting yourself instead of others. Because everything that we do almost on the life is we do it for our wife, we do it for our kid, we do it for our family, we share money here and there. But what are the treats that we secure for ourselves?
We don't treat ourselves to have that.
The food that we eat. But the health insurance is even if you have a car, you have insurance for your car. Okay? But what about your own life? Making sure that you can go check your system to make sure that you're good. So that it long last. So that's why health insurance is very important. That's what I'm focusing on that for, to educate the community about that and also how they can apply so that they will not be surprised that, oh, now I have insurance and that, out of nowhere, now look at how much they are charging me. So once you are aware, you know the expectation.
Okay. Yes. But then maybe how can you create more awareness to people, more especially the young people? They say they are healthy, they don't need to go to hospital. knowing that a disease will come anytime when you don't know, particularly the immigrants.
Yes.
Because they come from countries where people never had insurance, and when they come here, for more especially you now that you are also an immigrant, how will you be able to help? Do you think these people can be helped? More especially the young people.
Yes. For the young peoples, there is a two-way. First is to reach out to this kind of event, or I would say a multiple way. Having this kind of event and to talk to them about importance to have a health coverage, and also explaining to them that when you have a health care, you are investing in your own life for the future. This is the only material thing for yourself. And second, hosting educational event seminars. And if it wasn't for COVID-19, we have been planning to have like a seminar event, like when there is a public event, like a soccer tournament, we were hosting to be partners with those events so that we can talk to those young, share the flyers and explain to them how important it is to have a health coverage. And people who are actually working, the goal is to reach out to them, explain to them what are the healthcare coverage that they are having, what kind of a document they need to look into before they choose. Sometimes some people who are working, they just choose which one has less coverage, which one has a less premium. They can give you, this is a medical advantage, and this one is, let's say, PPO, and preferred provider organization plan, and this one is a Medicare saving plan, and this one is a Medicare Advantage plan. And then they usually say Medicare Advantage saying you pay $100 a monthly, but the deductible is so high, to the point that even if you need a help, you go to a coverage, you're gonna be facing all that yourself. So those are the three things that they need to pay attention to. Well, and also plan accordingly. If you know that you have insurance, you have a medical need for a certain year, you have to plan accordingly for that year so that you don't be surprised. And the example I give to people most of the time is that if you know that you have been diagnosed with appendicitis, for instance, and this year you have to go for operation, and you have to make a sacrifice. In America, every year you have to sign up for healthcare coverage every December, November to December. So that year, you're going to have a medical coverage. You have to switch a plan that is affordable, have a less deductible. And then once the year passes, then you can change it back to saving plan where it can be advantage plan. And every HR is aware and know about those options that you have to switch. Some people just focus on a small premium, and then they later be surprised when they go to hospital. So that's a kind of a loophole that people need to pay attention to, that we explain to people.
Now, do you think now, because I know previously they used to have you can go and get an emergency health insurance if you got sick. Do we still have such a provisions these days?
But if you go to MNsure, they will have emergency program like that the county can do for you. But to people who are less than 65 who are actively working, it depends on your policy. It depends on policy. Each policy is different, and I can confirm publicly that it's there 100%.
So now that how can people reach you and be able to get signed up? Those who want to sign up with you.
Yeah, I have a business card that I pass out every time. To nowadays, if you
you don't
Facebook, you go to Facebook and you search my name, you're gonna find my name there and reach me. Or I have a small website that I'm working on called Life and Health Access. And if you Google that, it's not app, it's two of them. There's another one called lomepolice.com.
You say it live and what?
Life and Health Access. Yes. Life and Health Access.com or lomepolice.com. those are two different websites that I'm throwing out there to project so that I can reach out to a lot of people. On Facebook, also, if you Google or you search lomepolice.com, I post, barely a few information there. My goal is to make it as a non-profit to reach out to people. And you can also put a lomepolice.com there. Then you can find my information. I think it will be out there.
Lome Police.
Yes, LOMEPOLIS, like Minneapolis.
Lome Police.
Yes, like Minneapolis.
POLIS.
Yeah, .com.
Okay. Oh, yeah. So they can put it on the screen so that people can see your website.
Yes.
There. So what else could you be able to advise? What generally you can advise about health?
Yes, I want to talk particularly for people who are turning 65 or people who turn 65. People who turn 65 this year, they have 3 months to apply. If you turn 65 for the year, from the year you turn 65, you have 3 months to apply for Medicare through Social Security Administration to avoid any penalty for your premium in the future. Basically, that means if you don't apply, let's suppose if you turn 65 in March, you have until June to apply for Medicare through Social Security Administration to avoid any penalty. The penalty will be increased in your premiums or some other penalty of qualification.
Okay.
And I want to talk a little bit about that particularly for people who turn 65. Sometimes they forget that, because I'm in a government program, usually when they are not working or they retire, they are in a government program, they forget to do that part. And then they get kicked out of the program sometime, and then they have a bill and they go to a lot of tracassery and, here and there before it gets resolved. So if you know you are turning 65, usually you have 3 months before your birthday to apply, or 3 months after your birthday to apply. That 6 month window, you need to act on it. You can apply for your Medicare benefit without claiming your Social Security benefit. Those are two different benefits. You can also apply for your Medicare benefit when you turn 65 without applying for your Social Security benefit. They have those two options there. You have to click on one. Some people, you can wait. You can also apply for your Medicare benefit and then continue working until you retire at the age of 67, which is advised in the US. Well, you can also retire at 62. The only difference is if you retire at the age of 62, you will get less, Social Security premium payment over time, over lifetime. So people who are 65 and older, I really want to advise them, if you have any question, to reach out to me, and we can work to help them work through the application. And also if they need healthcare, they want to switch to a different plan, we have a plan through all different health insurance agencies. I have a plan through UCare. I have a plan to United Healthcare. I have a plan to Humana. I have a plan through what do you call it? What do you call the last one? Well, I will remember now. I will tell you. So all those they are all in the same bucket. When it comes to healthcare, there is not a competition. It's just a share of a data. So that's why, as a broker, I can advise client in any healthcare and tell them which one is better for them. They are the one who choose which company they like and how their provider helped them, and then they can choose to be there.
Okay. Well, our time is over, and it was really nice talking to you. And I hope this will help many people. So those people, you can go to liveandhealthaccess.com or lomepolice.com for more information. And we wish you best of luck in your endeavors in trying to help people get insurance.
Well, thank you very much for having me today. I really appreciate, and let's continue like that, helping the community in our own small way, and one day to get to everybody.
Thank you.
Welcome to KJ TV for your greatest news and programs. I'm glad you're here to listen to wonderful program coming to you. And please don't forget to subscribe or give us thumbs up.